Hey guys, welcome back to the channel. Today we're going to be looking at oral manifestation of systemic diseases. Oral manifestation of systemic diseases can be seen as an early indicator of an underlying systemic condition. The oral cavity is frequently involved in systemic diseases, and the identification of oral signs can be an essential component for accurate diagnosis. In this video, we will explore various systemic diseases and their oral manifestations. So this video aims to provide an overview of the various systemic diseases that can manifest in the oral cavity. We will look at infectious diseases, autoimmune conditions, granulomatous disorders, drug-induced lesions, hematological disorders, endocrinological diseases, genetic diseases, head and neck syndromes, and neoplasia involving the oro-facial tissues. So let's look at infectious diseases. Oral manifestation of infectious diseases can range from simple oral thrush to severe necrotizing ulcerative gingivitis. In HIV patients, for example, oral candidiasis, herpes simplex, and Kaposi sarcoma are common oral manifestations. Tuberculosis and syphilis can also involve the oral cavity, presenting as ulcers or nodules. Koplik spots. These are classic signs of measles. Koplik spots are small white lesions that appear on the oral mucosa. You can also get a strawberry tongue, and these are a classical feature of scarlet fever. Oral hairy leukoplakia. This is a viral infection caused by the Epstein-Barr virus that typically affects patients with a weakened immune system. It presents as white corrugated lesions on the lateral borders of the tongue. Autoimmune conditions. Autoimmune diseases such as lupus erythematosus, Sjogren's syndrome, and pemphigus vulgaris can cause oral lesions that present as painful ulcers, white plaques, or bullets. Other conditions such as Behçet syndrome can present with oral ulcers, while sarcoidosis can cause oral granulomas. Lichen planus. This is an autoimmune disorder that can cause oral lesions that present as white, lacy patches or erosions. Patients may also experience burning or discomfort in the affected areas. Granulomatous diseases. Granulomatous diseases like Crohn's disease and Wegener's granulomatosis can cause oral lesions that present as nodules or ulcers. Melkeson-Rosenthal syndrome, a rare granulomatous disease, can present with recurrent oro-facial edema, facial nerve paralysis, and lingual plicato, which is associated as a fissured tongue or a scrotal tongue. Next, drug-induced oral lesion. Certain medications can cause oral lesions, including aphthous ulcers, lichenoid reactions, and erythema multiforme. Common culprits include non-steroidal anti-inflammatory drugs, antibiotics, and anti-epileptic agents. Hematological disorders. Hematological disorders such as leukemia, lymphoma, and multiple myeloma can cause oral manifestations such as gingival hyperplasia, petechiae, and necrotizing ulcerative gingivitis. Thrombocytopenic purpura and hemophilia can also cause spontaneous bleeding in the oral cavity. Iron deficiency can result in a smooth, shiny tongue due to atrophy of the papillae. This condition is also known as glossitis. Endocrine diseases. Endocrine diseases such as hyperparathyroidism and diabetes can cause oral manifestations such as oral candidiasis, periodontal disease, and xerostomia. Amyloidosis. This is a disorder characterized by the deposition of amyloid protein in various organs, including the oral cavity. The tongue may appear enlarged and is one of the causes of macroglossia, and oral lesions may present as nodules or ulcers. Acromegaly. This is a hormonal disorder that results in the overproduction of growth hormones. Oral manifestations include enlargement of the tongue, jaw, and lips. Patients may also have malocclusion and obstructive sleep apnea. Genetic disease such as Down syndrome and osteogenesis imperfecta can cause oral manifestations such as delayed eruption of teeth and enamel hypoplasia. Head and neck syndromes such as Treacher-Collins syndromes can cause facial deformities that affect the oral cavity. Peutz-Jeghers syndrome. This is a rare genetic disorder that can cause multiple gastrointestinal polyps and pigmentations of the lips and oral mucosa. The pigmented spots can be seen on the lips, tongue, and buccal mucosa. You can also get metastases to the oro-facial tissues. Metastases to the oro-facial tissues can occur from primary tumors in the breast, lung, prostate, and colon. These metastases can present as oral ulcerations or swellings or masses. Multiple myeloma. This is a cancer of the plasma cells that can cause oral manifestations such as bone pain, tooth mobility, and oral lesions that present as masses or ulcers. Lymphoma can present with oral manifestations such as enlarged lymph nodes, ulcers, and swelling. Patients may also experience pain, discomfort, or bleeding of the gums. Well, there we have it. The oral manifestations of systemic disease and conditions can be diverse and varied. Recognizing these signs and symptoms can lead to a timely diagnosis and appropriate treatment. As healthcare providers, it is important to be aware of these conditions and to work closely with our patients to ensure their optimal health and well-being. Well, thank you very much for listening. We hope you found the video useful and it will aid in your revision and being able to identify these systemic manifestations, which possibly one day you could save someone's life by recognizing these particular type of lesions. Well, thank you very much again. Please kindly like and subscribe to the channel, and we'll see you back again in the next video. Thank you again. Bye.